But before I answer that question, let me just make one point about school closures, which is that the virus also closed schools. It wasn't always
No, you're
just
right.
cautious politicians and teachers unions. So you can look at articles, especially from the Delta wave and the Omicron wave, from Georgia, from Texas, from Florida, from Kentucky, not from Democratic states. Although I guess Kentucky has a Democratic governor, but anyways, it wasn't just overly cautious politicians. And even when schools were open, sometimes there were too many sick teachers to teach. I know at least a couple of days here in New York City, my kids just sat in the auditorium all day and did nothing. Other times, people had to bring in the National Guard to teach students. And the Great Barrington Declaration and the doctors that I write about it, they reacted to this by pretending it never happened. So you will never
Yes.
find them even acknowledging that the virus also closed schools. And this
Yep.
also happened in vaunted Sweden. So
Yeah.
Sweden never shut down its elementary schools as a country, but I don't know about hundreds, but one article that I wrote for Science Based Medicine is about 50 screenshots that someone compiled of just school closures in Sweden. So it really
Yeah.
was just cautious politicians. Now,
No,
as
you're
for
true. I'll just to sort of put that in context. I had one kid in a Catholic school and one kid in a public school. And the kid in the public school, the pandemic started his junior year and ended his senior year of high school. So those are, sort of big years. And he didn't get back to school until April of his senior year. So he had more than a year off of school because actually 2 weeks before any lockdown started, his teachers all went on strike, which I completely support, by the way. They were on strike for good reasons. But the public school was unable to gather the resources to reopen schools, right? Like they didn't have the ventilation, they didn't have the masks, they didn't have the number of teachers, they couldn't get the class sizes small enough. The little Catholic school could sequester off every single classroom so that they never saw more than 20 people at school a day. They ate lunch in the classroom. They had like little plexiglass between students. Like they could do all these things because of how small they were. And I think that all schools had to be closed at least for some amount of time. But we also never ever put the resources into helping schools reopen.
Yeah. So all the doctors that I write about to varying degrees were against masks. They were against testing. They were against vaccines. They were against all measures that could have actually helped open schools. So I refuse to cede the school closing ground to these doctors. They were very pro saying the words open schools. They wanted their reputation as people who wanted schools open. Whether schools actually opened, I don't think really concerned them. And I'll also say that teachers were vulnerable. Here in New York City, during the first 6 weeks of the pandemic, we lost 74 Department of Education employees. 70 of them worked in schools, 30 of them were teachers. And the authors of the Great Barrington Declaration dealt with this by saying most teachers are young. They can handle COVID just fine. And the idea that maybe they lived with their elderly mother or anything like this, never really sort of seemed to occur to them. So would teachers have returned to school in mass, had schools been open? Would parents have sent their children to school, especially here in New York City, where we have a lot of multi-generational homes who are stacked up on each other? Whether children were actually in school learning mattered less than they cemented their reputations as people who went on the media and said school should be open. So they were looking out, I think, for themselves and their reputations, not whether children were actually in school learning. To get back to your original question about, the potential neurological complications, I don't know. My attitude for this is we just have to be humble. I mean, there are some worrying signs, that at least children who get very sick from COVID, about 1% of hospitalized children emerge having seizures. We have to be humble about the consequences of repeat infections. A kid who's born today might acquire COVID 20 times by the time, they go to college. Who knows? Probably not that many, but I am very careful. I hope not to come across as a fear monger. I mean, there are, and there were certain doctors on social media who panicked about every variant, a red flag giant alert, or if there was a case report of, one person who got COVID, and then, had the brain-eating amoeba. I don't know, that COVID causes the brain-eating amoeba. So I don't defend that sort of fear-mongering. I just try to take a conservative approach to things and say, hey, we have to be cautious about the potential for consequences that we can't appreciate now, especially in unvaccinated children. So I don't want to fear-monger about things. Do I think masses of children will develop Alzheimer's disease at age 20, probably not. But we just have to be careful and cautious because there's a precedent for many other viruses to do this, as we know.